Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, January the 11th. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Tuesday, and Wednesday, we'll be providing written briefings at 3 o'clock with important information about COVID-19 in BC, including case numbers and the progress of our immunization effort. On Thursday, we'll be providing a briefing, Dr. Henry and I, right here in the Press Theatre in Victoria. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. So today we're reporting on our weekend numbers. So 3 reporting periods from January 8th to 9th. We had 538 new cases diagnosed with COVID-19 in British Columbia. From January 9th to 10th, an additional 507 new cases, and in the last 24 hours, 430 new cases. That brings our total number of new cases diagnosed to 1,475, including 9 epidemiologically linked cases. And our total in the province to 58,107 people who've been diagnosed with COVID-19. The new cases include 287 people in the Vancouver Coastal Health Region, 736 people in the Fraser Health Region, 59 people on Vancouver Island, 217 people in the Interior Health Region, 173 people in the Northern Health Region, and 3 who are new cases who normally reside outside of Canada. We currently have 5,220 active cases in all health authorities in British Columbia, of whom 358 are in hospital currently, 72 of whom are in critical care or ICU. We have 7,313 people under active public health monitoring in all of our health authorities, plus some additional in Northern Health. And 50,541 people have now recovered from COVID-19. Sadly, this weekend we've had 22 more people who have died in our province from COVID-19. And that means now we have over 1,000 people, 1,010 people who have died from COVID-19 in British Columbia. These, of course, are our grandparents, our friends, our aunts, our uncles, our sons and daughters. To the families, care providers, and communities across British Columbia, we know that this has been a most challenging time. Our thoughts and our prayers are with you all. We do have 6 new healthcare outbreaks to report over the last few days at Avalon Gardens, the Gatehouse Group Home, the Guildford Seniors Village, Heart House Long-Term Care on Vancouver Island, Kin Village, West Court, and Sun Creek Village. And additionally, 4 outbreaks have been declared over at the Abbotsford Regional Hospital, and thankfully the outbreaks at Bailey House, Chartwell Langley Gardens, and Lakeshore Care Centre have finally been declared over, and we know how challenging those outbreaks have been in all 3 of those long-term care homes where we've had numbers of people, our seniors, who have died from the virus in those outbreaks, and it's always challenging. We now have 50 active outbreaks in long-term care or assisted living, and 10 in different acute care units, involving 1,364 residents right now and 669 staff who have active cases. Today, we've had 1 new community outbreak declared in Canham Lake First Nation in the Interior Health Region. In addition, the LNG Canada Diversified Transportation Site in Kitimat, that outbreak is now over. Since the start of our immunization program in December, we have now delivered 59,902 vaccinations as of yesterday, so it doesn't include today's doses. But that's 59,902 of the 71,200 doses that we've had here in the province. That includes 48,533 of the 50,700 doses of the Pfizer vaccine that we received, and 11,369 of the 20,500 doses of Moderna vaccine. And we recognize we've put less Moderna vaccine in arms to date, but there's really good logistical reasons for that, as the Moderna vaccine is what we've been able to deploy to many of the more remote or isolated communities, including some First Nations communities, and the flexibility that we have with the Moderna vaccine makes that possible, but it also makes it challenging because it does take much longer to get out to communities. We do expect to fully use up all of the Pfizer vaccine that we have in the province by today, and we are awaiting our supplies to come in the coming days. As well, we're awaiting an additional shipment of Moderna vaccine this week. As we spoke about last week, much thought and consideration has gone into our immunization delivery and approach, and we started slow and steady and made sure we had all of the building blocks in place. The approach is based on our available supply. We're the highest risks in our province and who is at risk to be mostly severely impacted by the virus. And this has been the approach that we've been taken, recognizing that we have a limited amount of vaccine that is coming between now and the end of March. Everybody is important in British Columbia, and everyone who is wanting the vaccine and is able to receive the vaccine will have access to it. But we know that some people are at higher risk, and that is why they are getting immunized first. If someone is at higher risks, it means they're either more likely to have severe illness, or their circumstances or activities make them more likely to be exposed or to potentially spread the virus. And that is what we're focusing on at first. We do not have enough supply coming between now and the end of March to achieve that community immunity that protects us all. So what the approach that we are taking, as with other provinces across the country, are to best protect as many people who are most at risk as possible, to prevent hospitalizations, to prevent deaths, and also those people in our healthcare system to make sure that we have the resources available to provide safe care to everybody. But let me be clear, everybody will have their turn. The focus is on these core groups between now and the end of March, but we expect more vaccine and more vaccines to be approved for use come March. And starting in April, we are working on the details of how we are going to sequence once we start having sufficient vaccine that we can immunize more people in our communities across the province. These details will be coming. So if you haven't seen your name on a list for after March, it's because we are working out those details, both here in British Columbia and across the country. But we will absolutely be looking at our essential workers across the board. We will also be ensuring that we make allowances for people who are at risk by age, by underlying conditions, etc. So those details are coming, and we just need everybody, please, to be patient. I also want to address the decision that we have made to start giving second doses at day 35. This is a science-based approach that takes into account the limited vaccine we have early on in the program here in the province. As we know, when someone receives a vaccine, it stimulates our own body's immune system to produce antibodies to that antigen, that protein. And these new vaccines that we have, messenger RNA vaccines, have proven to be very effective at doing that. When you provide the second dose, that's what we call priming the immune system with the first dose. The second dose, in a 2-dose series like this, is to provide more durable and longer lasting, for a longer period of time, immunity. And that's what we call a boost. And we call this a prime boost. And we know a lot about immunization programs and our body's immune system and how they respond. By waiting between doses, it allows the body to build up that immunity, to be primed, to develop both the antigens, the antibodies that attack the proteins on the surface of the virus, but also for the body's cell-mediated immunity, our T cells and our B cells, to start to recognize the antigen or the offending protein, the virus as well. Right now, as I mentioned, we are vaccinating as many high-risk people as possible in this initial period and setting the second dose to just over a month later. So that is the process between December and March. And that is because we know that the vaccine that we are receiving, will be receiving, if it comes, as we've been guaranteed or we've been told, will be back-end loaded. We are getting more doses in January than we did in December, more doses in February than we did in January, and more doses in March, quite a large step up in March compared to January and February. So our decision is around maximizing the distribution while balancing the supply and making sure we have a safe and effective immunization program. And we did not take this decision lightly. It was made after reviewing the scientific evidence here in BC, but also nationally and internationally, in consultation with the immunization experts that we have here in British Columbia. We have a very strong immunization program led by Dr. Monica Naus at the BC CDC, with our Vaccine Evaluation Centre and our BC Immunization Committee. As well, we have looked at guidance from the National Advisory Committee on Immunization in Canada, which is our #1 guidance committee to go to around everything to do with immunization programs in Canada, and they have had access to all of the data around the Pfizer and the Moderna vaccines, and they have experts on the National Advisory Committee table. I have been on it myself in the past, and that is where our basic expertise and recommendations come from in Canada. As well, here we reviewed the WHO SAGE committee recommendations and the Immunization Advisory Committee recommendations from both the UK, the US, and other countries. What we know based on the data from the clinical trials, both that's been published and that's been provided to the National Advisory Committee on Immunization through Health Canada, the data that we know from the trials shows that between the first dose, with 2 weeks after the first dose, so that gives the body's immune system time to develop the antibodies and the cell immunity that they need. The vaccine effectiveness, so the protection from the vaccine at 2 weeks after the first dose, was 92.6% for the Pfizer vaccine and 92.1% for the Moderna vaccine. That is, quite frankly, amazing from a public health perspective, looking at an immunization program. What we're learning is that this short-term protection is achieved rapidly and is very high. So the protection after the second dose in these clinical trials went from 92.6% to 94.8% for the Pfizer-BioNTech vaccine, and went from 92.1% to 95.2% for the Moderna vaccine. So what you can see is that the data from the clinical trial shows very clearly that we have early, sustained, high response to this vaccine that lasts for at least 8 weeks. And I say that because these trial data also show us that the people who were in the Pfizer vaccine trial received their second dose from day 19 to 42, and the Moderna trials, they received the second dose day 21 to day 42. And there was no difference between the people who got it at day 19 and the people who got it at day 42 in how well the vaccine worked after the second dose. And there was no decrease in protection between the first dose and the second dose. So these are important things for us to remember. What we know is that it's much more important with a prime boost vaccine series not to give the second dose too soon, because your body does not have time to build up that priming in the immune system, and it's essentially a wasted dose. But we also know that for many of these 2-dose programs. The boost is actually more longer lasting and stronger if it's given later than the recommended time period. That we don't yet know, but we will be monitoring carefully for that. The WHO and NACI now have extended the interval, the recommended interval for doses, to 42 days, recognizing that that was perfectly safe and effective in the vaccine trials. And that is, we use that information along with our supply to try and get a nice, safe, and effective way of providing as much immunization as we can to high-risk groups during a safe and effective period. I will also say that there's been some discussion about a theoretical risk of increased pressure that might allow for a vaccine-resistant strain to arise if people don't have the second dose in a short period of time. And really this is, in discussions with our immunology colleagues, this is theoretical and really is not expected to arise with the very high levels of protection that we're seeing after the first dose, or in the particularly short time frame that we're talking about, the difference between 28 days and 35 days, for example. And we know that from the doses that we're expected to receive, that we can protect an additional about 150,000 people who are at high risk in our province by starting our second doses at day 35. Given what we know about our immune system, what we know right now about these very effective vaccines and how much vaccine we will receive, and we did an ethical review of this as well, and I will refer people to our ethical framework that's posted on the BC CDC website around our immunization program to make sure that we are being transparent about all of these processes. And we believe this is a reasonable and safe approach in our construct right now of limited supplies at the front end. We will, of course, continue to monitor carefully, and we'll be watching what is happening around the world, where we are looking at vaccine effectiveness, how long that protection lasts. In the UK, when they are extending to 12 weeks, is there an issue in between the 6 weeks and 12 weeks, for example? We'll be watching all of that very carefully, and we'll be monitoring and changing our program if needed, depending on how much vaccine we have and what we learn about the effectiveness of the booster dose. At this time, we are that much closer to the end of this storm. We cannot now abandon all that we have stood for and all that we have done here in BC to hold our line and protect our communities. We will get through this by lending a hand, by giving a wave or a smile, even behind your mask, to your neighbors, your friends. Kindness, compassion, tolerance, and understanding for each other is what we have taken as our mantras to get through this last year. We need to remember that now, as we are coming to that end game, as we are going through this period that is the most challenging. We have limited vaccine, we still have this virus circulating, but we know we can get through this. We know that these are the things that have got us this far, and they will get us through this next few months as we get more and more people protected in our community. Using our layers of protection, sticking with our fewer faces, making sure we are unwavering in our focus, no matter how much we want to ease up. These are the things that will get us through these next few months, and then we'll be closer to the spring and closer to the light. And we will make this happen by remembering to be kind, to be calm, and to be safe. Thank you.
Thank you very much, Dr. Henry. I wanted to start by offering my condolences to the families, the friends, the caregivers of the 22 people who passed away from COVID-19 over the last 3 days, 11 from Friday to Saturday, 6 from Saturday to Sunday, and 5 from Sunday to today. 13 of them lived in Fraser Health, 2 in Interior Health, 1 on Vancouver Island, 5 in Northern Health, and 1 in Vancouver Coastal Health. And their loss and the loss for their families is, of course, incalculable. And we wanted to assure them and that they're in our hearts and our thoughts today. Wanted to also acknowledge the extraordinary work being done in our healthcare system. As Dr. Henry has said, we have 5,220 active cases of COVID-19 in BC, 7,313 people under public health surveillance. Since the beginning of our influenza campaign, 1,413,131, at least that many doses of influenza vaccine have been put in people's arms in BC, which is, I think, an extraordinary success. That's not all of the numbers because there is some lag in reporting there. 358 people in hospital, 72 people in critical care, and today the good news, after some very difficult, hard, harsh days for all the people associated with Bailey House, with Lakeshore Care Centre and Langley Gardens and Fraser Health, where outbreaks were declared over. The work being done in public health care right now is extraordinary. On these areas, in primary care, in surgeries, all of the areas of public health care. Dr. Henry has noted that 59,902 people have received COVID-19 vaccines, including almost all of our Pfizer vaccine, 48,533 of 50,700 available doses as of yesterday. And similarly with Moderna, our doses have been distributed very widely in that case around the province, with 11,369 doses distributed. And just to put that in context, what that means is, because it's our expectation, in the middle of the week we'll be getting more Pfizer doses, and at the end of the week more Moderna, that we're likely to be out, essentially entirely out of vaccine by the time those new doses arrive. And that is going to be the pattern over the next periods. And so sometimes I think the debate is what percentage, and people talk about what percentage of the vaccines are in people's arms. Well, that will approach 100% in the middle of the week, and then of course when the new vaccines arrive it'll drop down. But what I think everyone can say is that in every part of our province, from Hartley Bay to Vancouver to Terrace to Fort St. John, everywhere in our province, that the work being done by people delivering on this campaign of these vaccines is truly extraordinary. I wanted to note, given the hospitalizations and critical care numbers, that our current occupancy of regular beds, our base beds in healthcare, is 87.8%, so well below 100% occupancy, which typically it would be at this time of year. That if you look at the overall number of beds, including the surge beds that have been added, that is 69.3%. Obviously, there are some hospitals that are facing real challenges because of the nature of COVID-19 in certain communities, but across the province you can see that on occupancy we're not facing the same challenges as other jurisdictions. In terms of critical care, I just note that 71.8% of beds are currently occupied in critical care. Those are regular base critical care beds, and 50.3% are essentially half of the overall beds are currently occupied. And part of that is the effort in planning, and you'll note the changing nature of COVID-19. When we had 149 cases, which is our height at the beginning of April, there were 72 people in critical care. Today there are 358 people hospitalized and 72 in critical care. But the people working, the nurses and the healthcare workers and the doctors in acute care, are truly doing an extraordinary job at addressing the needs of those patients. So I wanted to bring you briefly up to date on PPE, as we do on Mondays, just to say that over 8,095,000 or equivalent respirators have arrived since March in BC, 143 million surgical masks, 3 million pieces of eye protection, 326 million pairs of gloves, and 18.8 million gowns. Over the past week, since our last update on Monday, January 4th, 191,680 N95 or equivalent respirators have arrived, 6,000 surgical or procedure masks, 2,893 pairs of eye protection, 3,778,000 pairs of gloves, and 99,058 gowns. So just and finally, I'd say this is a time, and I think it's fair to say throughout the COVID-19 pandemic, we've relied on one another, and this is a time when we have to continue to take actions to justify, I think, our justified trust in one another to stop the spread. Right now, perhaps more than any time in our BC pandemic, our reliance on each other and our trust in each other must be unwavering. That trust is forged when, without hesitancy or reluctance, we use the skills we've been taught, follow the guidance we've been given, and yes, obey the health orders that keep us safe. Now is the time in the BC pandemic when all of us have to dig in. Each of us have to look within, and all of us must use our hearts and our heads to stop the spread. The work being done and its importance, especially in long-term care, but in other communities that are vulnerable as well. The work that has been done on vaccines is important. But right now, as we look across the country and across the world at the spread of COVID-19 and the ongoing challenges that exist, all of us have to dig in. All of us have to work hard. All of us have to follow the guidance in order to continue to stop the spread of COVID-19 while such important actions are taken care of in the healthcare system to give us so much hope. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle du 8 et 9 janvier, celle du 9 et 10 janvier et celle du 10 jusqu'au 11 janvier en mi-journée. Il y a eu 22 nouveaux décès liés au COVID-19 durant ces 3 périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 1010 personnes décédées de COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Pendant ces 3 périodes de référence, pour la première période de référence, nous avons eu 538 nouveaux cas. Pour la deuxième période de référence, nous avons eu 507 nouveaux cas. Au cours des dernières 24 heures, 430 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de COVID-19 en Colombie-Britannique, 358 personnes sont actuellement hospitalisées, dont 72 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up. Please also take your phones off mute. You are not audible until your name is called. First question today is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry. You may have heard that Canucks training camp was shut down yesterday when a player had a positive test. Now, he's since tested negative twice, and the Canucks are calling the first one a false positive. The team said they don't use the 15-minute rapid test. So can you explain why there would be false positives in regular nasal swabs? And do you feel confident after several negative tests that that player is not actually carrying the virus?
Yeah, so I can't talk about this specific player because I don't know the details, but this is something that we have had to deal with all along. We know there are false positives and false negatives with all of the tests that we have. None of them are 100% what we call sensitive or specific. So it's a balancing that we find. The nasal pharyngeal swab, depending on which lab does it and how well the swab is taken, the sensitivity, the detecting somebody who truly has the virus can be as high as 98%, but it's not 100%. And nor is the specificity. So yes, we've had false positives, especially when the rate is low and the pre-test probability is low, and we've been dealing with that all along. It's one of the things that one of our challenges with tests, and even the gold standard PCR test that we're doing in the BC CDC lab, and of course my colleague Dr. Cradgton will cringe at this, but even they sometimes have false positives and false negatives. It's innate in what we do, and why it's so important that we have the clinical context around that situation. Was there an exposure? Was there symptoms? Those are all things that are important. And yes, we more likely expect to have false positives in asymptomatic people with no risk factors.
Follow-up, Shannon?
Yeah, a question for a colleague. Relatives of a senior at Peace Arch Lodge in Surrey recently learned after pushing for information that their loved one's scheduled COVID-19 vaccine was canceled due to an ongoing outbreak on their floor. Now, while it appears the shot's been rescheduled, how is public health handling vaccines in care homes with active outbreaks to ensure everyone who can still be vaccinated will get one and so they're protected sooner? And will those plans be clearly communicated to families?
Yes, and it has been an evolution. At first, we weren't sure whether whether we could give vaccine to people who were in the incubation period or exposed, or who had tested positive in the past. As more information became available, we realized we were able to do that. Obviously, people who are positive today, who have symptoms, the vaccine is unfortunately not going to give them benefit. But we do want to give it to people who have been exposed, who are in the incubation period. Some of those people will have, it will be too late. They will already have enough virus that they will develop illness, regardless of having the vaccine. But for some people, if they have not yet been exposed in an outbreak situation, it will prevent that next generation of exposures, and that's what we're hoping for. So there has been a shift to a focus on prioritizing care homes where there have been outbreaks to make sure that everybody who can gets immunized, and we're starting to see some of the impacts of that. There have been people who in outbreak facilities who've received the vaccine who've gone on to develop disease, and that's not unexpected. But what we're hoping is it's going to take that tension away of, am I next? Is it going to be my room next or my ward next? So that's the focus that all of our health authorities have been pivoting to I hate to use the word pivot, have been changing to based on the information and the more data that we get over the last few weeks. So as you say, that the initial concerns, and I know there were concerns initially from a number of different aspects, including immunizers who were concerned about going into outbreak facilities. But now we have our immunizers protected, both so they aren't bringing virus in and also so that they aren't at risk of virus as well. So a lot of things changing as we're learning more about how to effectively prevent transmission, particularly in long-term care homes.
Next question is from Bon Palmer, Vancouver Sun.
Good afternoon, Dr. Henry. Early in the pandemic, when discussing community immunity or herd immunity, we often heard the number 60% to 70% might be enough. Lately, I'm seeing estimates that it could be considerably higher. I see Dr. Fauci in the U.S. saying, well, it could be 85 to 90%. Do you have you had occasion to revisit those estimates, and what would be the implication if it is higher, please?
Yeah, so we have been thinking about this and talking with our modeling teams and others. So really what we're looking at for community immunity, herd immunity, is the reproductive number. That gives us a sense of how infectious a virus is, or a bacteria even, but particularly with viruses. So if we think about the ones that we have immunization programs for, and this is important because the concept of herd immunity or community immunity really is about how many people need to be immunized. It's not about people getting infected with that virus or that bacteria, because that confers immunity in a different way, but it also has the inherent risk of hospitalization and death, which we're trying to avoid. So the concept of herd immunity is based on our reproductive number, and if we look at measles, which is the most infectious virus that we have an immunization program for, and measles has an R0 of about 13 or higher. So we think about influenza, it's down around 1.5 or so. For this virus, we're seeing it somewhere around 2-ish, the R0, so in the naive population. So that if we look at an R0 around 2-ish, then we're thinking if we have enough, 60 to 70% of the population is immunized, that should prevent those transmissions to most people. it still will not prevent some of those super spreader events if they're in the right situation where you happen to have an ill person and a bunch of people who are not protected in an indoor situation with crowds, etc., and poor ventilation. But that could be, that could be enough to stop that widespread community transmission. Where I think Dr. Fauci and others are concerned about is the increased transmissibility we're seeing with some of the things like the UK variant. And as the R0 goes up, and they're saying maybe by 0.4 or 0.7, so from 2 to 2.7 or 3 somewhere around 3, then you need to have more people protected before you can prevent those transmissions. So before the virus it runs into dead ends wherever you go. So yes, people are concerned that with particularly variants that we're seeing arise, that we may need to immunize more people. We're continuing to look at it as we go. I think that probably 70% is something to aim for. But of course, we want everybody to be protected as soon as we possibly can.
Vaughn, do you have a follow-up?
Yes. In discussing the issue of healthcare workers and workers in long-term care refusing or choosing not to be vaccinated, we've heard that, well, it might not be a problem because most would be vaccinated, and so if herd immunity or community immunity is low as 60%, then that wouldn't be an issue. But I'm wondering if it is higher, would thought have to be given to reassigning people in long-term care or health care who choose not to be vaccinated?
Yeah, probably not reassigning. I mean, this is something that we've considered for many, many years, and around influenza immunization every year, where it is so important for us as healthcare workers because we know that the influenza vaccine doesn't work as well, particularly in older people and people with compromised immune systems. So really, they are dependent on us not bringing influenza into a long-term care home, for example. And we know that with concerted efforts, we can get immunization rates up to 80%. And that has a protective effect, particularly in long-term care homes. The corollary, of course, is this vaccine provides protection to elderly people as well. And from what the trials show, that's very good protection. So that helps us as well. But the other thing that is incredibly important, we do not yet know from this vaccine whether it's going to prevent infection and that low level of transmission that can happen. So right now, we all need to continue to take those measures like wearing personal protective equipment, keeping our distances from each other in enclosed spaces, all of those things that we're trying to do now, monitoring ourselves for symptoms every day, getting tested regularly. Those types of things will need to continue for the foreseeable future. We will have more data by next week about coverage rates in the care homes that we're immunizing last week and this week, and we'll have a better sense of that. But I'm also hearing from many, many care aides, nurses, physicians across the province and from my immunizer colleagues that the uptake is very, very high in BC. And I think that has a lot to do with being open about the vaccine, about what we know, what we don't know, providing people with people absolutely have questions, and that's what we are there to answer so that they feel confident receiving the vaccine and knowing that it's safe and that it works.
Next question is from Camille Baines, Canadian Press.
Hi, Dr. Henry and Minister Dix. Considering the outbreaks at hospitals, acute care settings across the province, including at St. Paul's among cardiac patients, why is routine pre-op testing for COVID-19 not being done except in the Fraser Health region, despite rising positivity rates?
Yeah, so we have a whole process around when we're doing that type of testing, and it's based on risk in the community, percent positives coming in, and we started it in the Fraser Health region. As you will recall, that's where the rates were highest, and it only changes one's management in certain conditions. So, pre-op is one thing, and the cardiac units are not pre-op. So there are several different areas where we are doing routine testing of people, depending on the situation in the community and the rates in the community. As well, there's a very high index of suspicion, but sometimes cases are missed.
Camille, do you have a follow-up?
Yes, I do. I understand that in the Northern Health Authority, for example, the prevalence rate went up from 0.5% in October to 17.5% in the first week of January, and this is data from the BC CDC. So why wouldn't testing be done there before patients come in for surgery?
Yeah, it's because if we look at where people are, who is getting sick and where they are getting sick and how we understand the transmission in the community, it's not necessarily people who are waiting for surgery who are at risk. So it really depends on the local epidemiology, and absolutely Northern Health has had very challenging few months. But particularly the last few weeks, and their percent positivity continues to increase. But it is very much limited to communities where we're having ongoing contact tracing and contact management with public health. But these are things that they monitor carefully.
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. Hoping to ask you today more about the vaccine distribution and whether or not you've encountered any problems with doses having to be wasted yet because they're not handled properly. And in some COVID-free zones, I'm also hearing from people complaining about still being confined to their rooms since November when they're not anywhere near being exposed to it. So mainly just, have you encountered any problems with vaccine doses being wasted?
No, and so far so good. We put a lot of time and effort into making sure we had people trained, that we had the infrastructure in place, and we talk about over the Christmas weekend not putting enough doses in people, but part of that was making sure we had the right equipment to be able to safely move vaccine, and the right vaccine to be able to do that, and that people knew how to handle it, because as I've said a number of times, there's a lot of fussiness about making sure the vaccine is stable. So no, as far as that is one of the things that we monitor quite carefully, vaccine wastage. We have not had any serious concerns with vaccine wastage, and there's a process in each health authority for once the doses are coming up to the end of the 6-hour period, if there's not people there for their appointments, that we have other people who are on the priority list who are able to come in and receive the vaccine. So I've not heard of any concerns. In terms of people, it is something that of course we're watching very carefully. In terms of long-term care homes, we are still at the point of giving everybody dose 1, and it takes time for your immune system to develop enough antibody that you are protected. So it's a couple of weeks after dose 1. So we're not yet at that point where we can let up on keeping people safe distance, on wearing PPE, on reducing the numbers of people who are going into long-term care homes. But that is the future. That is what is going to happen once we have everybody protected in those communities that are most at risk. And that's our aim, priority 1 across the province.
Follow up, Marcella?
Just regarding the tools in your box right now to try to keep numbers coming down, because we have noticed that numbers have slowly kind of dropped a bit, but we're still seeing 22 people die over the weekend. So what more do you think you're prepared to do to ensure that people are following the rules when we are still seeing some people ignoring them?
Yeah, so we're obviously thinking about lots of things. We renewed our orders as of Friday and kept them the same. because we know we're not out of the woods, and we saw this in October where we started to have a bit of a dip, and with cases of 500 a day, that can start to go up exponentially very quickly. So this is such a critical time. I get so challenged with it because I know how tired we are, and we hear these stories about politicians in other provinces going off on vacations and things, and thinking that it's not serious enough. But we know what we need to do here in BC, and we know that we can get these down even further. We watch what's happening in Ontario and Quebec and next door, and where hospitals are getting overwhelmed again. We need to keep holding our line here in BC, and that means keeping our social gatherings small, making sure we're using all of our layers of protection in our workplaces, that we're not letting our guard down right now. Right now, of all times, we have to step it up, because there is an end. And we're at that part in the marathon when we're tired and we can stumble and get injured, but we need to support each other to keep this going, because there is an end. And it's part of it's because of vaccine, and part of it's because we're keeping our rates as low as we can, and that saves lives every day.
Richard Zussman, Global News.
We're hearing from the restaurant and bar industry again, Dr. Henry, around concerns around the communication of the new rules brought in before New Year's Eve. And they would like to know if you'll make a commitment to ensure that there's better communication next time there are changes made in the restaurant or bar sector, including potential changes around events that could be coming up in the near future, and whether you acknowledge that the communication could have been done differently around New Year's Eve.
Yeah, I will just say that the communication around New Year's Eve was done for a very specific purpose. Because of the information that I was receiving from the beverage industry, from the restaurant industry, but also from municipal leaders, from others in the community who had concerns about things that were being planned. And we had discussions about what were the public health issues that we were trying to address. And it really was about overconsumption of alcohol later in the evening. So that's why we targeted all of the places where alcohol can be sold. So stores, grocery stores that sell alcohol, restaurants and bars. And that was done at short notice because of the issues that arose. And I needed, we had an imperative to take some action knowing what we knew. I know this has been a hard year for the restaurant industry, and I am committed to making sure we can do what we can to keep them open safely, and I absolutely applaud how many restaurants are doing amazing things to keep things going, to provide a safe place for people to get out of their house, to have a meal, to do that in an environment that's safe. And I personally appreciate it because I think I probably would not have got through this last year without the support of the many great restaurants that I have been privileged to go to. I do meet, my office meets every couple of weeks with the beverage and restaurant industry representatives, have been for many months, and I've committed as well to having a discussion with them about coming events over the next coming months to again look to them for ideas about the things that we can do to make things safer for people, and to make sure that we're doing everything we can to support the industry on the other hand.
And just to add, I think one of the strengths of what we tried to do in BC, and I think one of the reasons why there has been, I think, strong support for the measures put in place by Dr. Henry, is the consistency we've put forward over time. If you look at many jurisdictions across North America and across the world, you've seen very significant changes day to day, and speculation about changes all the time. And we've been pretty consistent here. The change we're talking about, I know people in the restaurant and bar industry didn't like, which was to change last call by 2 hours on New Year's Eve. But if you look across the country and in jurisdictions that have significant rates of COVID-19 in Quebec and Ontario and Manitoba, Alberta here, I think the consistency of what Dr. Henry has done has made those measures more effective, I would argue, and also has been a hallmark of the way we've approached COVID-19 in BC. So I know that there was concern around New Year's Eve. I know that many people in the industry felt badly about it. But the consistency of approach has been beneficial, I would argue, even to those industries themselves. And that's going to be continued to be our approach. And I think on every decision I know from Dr. Henry, every decision that she takes and that we take, consultation is important, but also the consequences of that decision, intended and unintended, are always considered. And I think that in general, we've been on a good path for that reason, and we have to continue on that path, but people have to dig in now. This is an important moment in COVID-19 in BC. It's absolutely critical. Vaccines are being used, and we'll have immunized about 10% of the population by March 31st, which means we've got a long way to go to that point and then beyond. So right now is a time when it's more important than ever to understand the measures, which have been pretty consistent now since the major changes were made in November and December. Understand those measures to ensure that we live them in our daily lives.
Follow up, Richard?
Dr. Henry, before November, there were a number of cases in long-term care where there was just one case in a care home and it was caught before it spread. We are seeing that far less regularly now. And as you acknowledged at the beginning, today is a grim milestone with over 1,000 deaths now here in British Columbia. Why have we seen a more rapid spread of the virus in long-term care recently? And once again, the Seniors Advocate is calling on the province to implement some additional layers of protection in long-term care, including the same sort of testing policy we see with the film industry and the NHL applied to staff at long-term care. So are you willing to put in those additional layers of protection and testing in long-term care? And why do you think we have seen more spread within those care homes recently?
Yeah, so the spread really reflects what we're seeing in our community. And yes, we had a lot of single healthcare worker being able to detect it, keeping it from spreading early in September, October in particular. But it is a reflection of the increased transmissibility of this virus at this time of year, and the fact that we have people who work, there's 30,000 staff who work in long-term care homes around the province, and it reflects exactly what's happening in our communities. I think the challenge that we have is, we have all these measures in place, and it's very difficult to pay attention to them all the time. And what we need to do is step up again our personal protective equipment, making sure that people know how to use it appropriately, doing that active screening every day when you go into work, whether we add testing, and we have been doing testing in certain, when there's an outbreak, there's testing of everybody, asymptomatic testing of everybody on a periodic basis, trying to step up the screening, and absolutely we'd be open to doing, we've been looking at the rationale, doing nasopharyngeal swabs twice a week. I know Ontario's been doing that for some time, and it does in some cases help, in some cases not so much. So we have been absolutely looking at all of the options. I'm happy to hear that we're focusing on things like nasopharyngeal testing. I will say that all of these take resources, and do we have 600 nurses go to each of our care homes to do the testing? We can divide it up so there's maybe not that many, or do we focus on some of the other important issues like reinforcing the screening and the infection control measures within the facilities? All of these things are being looked at on an ongoing basis, and with every outbreak, we learn a little bit, but absolutely, it's an ongoing iterative process.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Susie De Silva, CBC.
Thank you very much. Dr. Henry, you mentioned earlier, and I know Mr. Dix mentioned this as well, that we're out of the Pfizer vaccine, expected to be out by the end of today. Does that mean that we are vaccinating with Moderna across the province, or is the rollout stalled, especially in urban areas, until we do get more of that Pfizer vaccine later this week?
Yeah, so the Moderna vaccine is already committed, so it's out there and it's being put into arms. It just takes longer because many of the smaller communities, it's broken down into smaller doses that go to many more places. So yes, once we finish the Pfizer vaccine that we have today, we are waiting for the shipments to come in this week. We know that some of them will be coming tomorrow, some Wednesday, and some as late as Thursday. It's as we're learning, we at least have a guaranteed number that's coming this week, but I just got the email a couple of hours ago about exactly what time each of the lots will be coming to what place in the province. So it is something that we are still trying to be nimble with and work through with our federal counterparts who do the delivery service. And I was very heartened to hear from our federal ministers that they're looking at trying to increase the amount of Pfizer that we receive earlier rather than later, so we can ramp up to give more.
Susie, do you have a follow-up?
Yes, please. Have the daily testing numbers increased to the level we were seeing before the Christmas holidays yet? And can our lower case numbers over the past few days be attributed to lower testing rates still, or perhaps that people did follow the rules over the holidays? And can we also get an answer in French, please?
I'd like to say both. So our testing rates have come up. They're not as high as they were prior to shutdown of some of the industries, et cetera. So we have been we've separated out what we call MSP and non-MSP lab testing, some of which is industry testing. So most of that hasn't come back yet, but we have been up in the 9,000, 10,000 range prior to the weekend. And I believe it was a smaller number yesterday. This number was only about 5,700 cases. So we do see a periodicity to the testing, and today's numbers reflect that yesterday on a Sunday, not as many people go for testing. But they have come back, not to the same levels, and it's hard to know because we look at our percent positive, and that tells us, are we getting people who are more likely to be, are they directed to testing because they have symptoms or because they've been told by public health or tested by public health, and there's some of that, and that's reflected in the increased test positive rates, and some of it, hopefully, is I don't dare say, but is lower levels, levels coming down in the community. And I do believe that that is part of it. And I just want to encourage everybody to keep doing what we're doing, because it is working and it's saving lives in our families and our communities.
And just to say with respect to vaccine, there's right now we're sort of looking at vaccine on a daily basis and looking at the results. And right now we've essentially used up all of the Pfizer, and we've allocated or used all of the Moderna vaccine that we have. And more will come later in the week, and this will be part of what we'll see for weeks and weeks to come. And so it's not a reverse of things. We're working closely with the federal government. We know they're doing everything they can with the 7 contracts they have with vaccine providers, 2 of which are operative now with Pfizer and Moderna to get vaccines to us, and we're doing everything we can to deliver it. So it's not our expectation in the weeks and months to come will be for a team effort, and so it's not criticism of anybody that we're out of vaccine. It just happens to be, because we've used it all up, that we're out of vaccine for a short period, and then we'll have hopefully quite a bit more. En français, je dirais que avant la période de Noël, On a eu 9 à 2000 tests par jour en général. On est arrivé là la semaine dernière. Pendant le week-end, hier, il y avait moins de tests, je pense entre 5 et 6 000. Mais je pense que ces chiffres ne sont pas complètement une réflexion du nombre de tests qui ont été faits. Mais quand même, et aussi les tests privés ne sont pas encore de retour en force après les vacances. Donc, il y a toutes ces considérations. Mais force est de reconnaître, c'est que nos niveaux de gens hospitalisés c'était à peu près 360 il y a une semaine, c'est à peu près 360 cette semaine. Il y a des gens qui ont besoin des soins intensifs dans nos hôpitaux. C'est en baisse légèrement. Donc, je pense que ces choses sont importantes, mais il est trop tôt de prendre quelques conclusions que ce soit sur ce qui s'est passé pendant la période de Noël ou au commencement de l'année. Mais il faut maintenant que des gens, tout le monde, décide d'être à fond, à 100% dans l'effort pour réduire la transmission de COVID-19. Je pense que ça marche. On a démontré dans le passé que ça marche et ça va marcher ce mois-ci, ce janvier-ci, si tout le monde est impliqué dans l'initiative. Merci beaucoup. Thank you very much. We'll see you on Thursday.